Welcome to the ObamaCare Compliance Manual. Navigating the maze of compliance is a challenge for every practice in the 21st century. This is Dr. Steven Weiniger, and we usually talk about posture and posture practice, but in order to have a practice going forward in the 21st century, we must be compliant with federal and state regulations. This will have a tremendous change on how healthcare is occurring from human resources, PHI, and billing process. And this seminar is being done with Dr. Don Cross. Dr. Cross sent me this image from the Office of the Inspector General of the United States. These are the people that are the cops for the U.S. And this is from their Healthcare Fraud Prevention and Enforcement Action Team, HEAT. Deliberate ignorance of the changes is an admission of guilt. And Dr. Don Cross is going to be teaching us a bit today about how to navigate these changes in fraud and abuse. Dr. Cross is the author of the ObamaCare Compliance Manuals for the Chiropractic Practice. He's a certified instructor for the Council on Chiropractic Guidelines and Practice Parameters. He's a board-certified disability analyst, and he's been a leader in the chiropractic profession. He is currently second vice president of COCSA, this Congress of Chiropractic State Associations. He's a full-time professor at Palmer, Florida. He's got his own clinic, and he's been the president of Florida Chiropractic Association, as well as serving on the board of directors for 12 years, in addition to other involvement with the profession. This is his effort to put together a real process, a protocol, a procedure to systematize becoming and staying compliant with the new changes. This is not legal advice, and you need to check with your own lawyer for your own personal practice decisions. Dr. Cross, welcome.
Thank you very much, Stephen. This all came about very suddenly for me, and I appreciate you, Dr. Weiniger, for doing this. I had made a presentation at the Florida Chiropractic Association's National Conference a few weeks back, and there was just so much confusion with everybody, with lots and lots of questions, so I decided to do these type of webinars, and I appreciate you helping me with that. There is just so much going on in 2013 that affects us in so many different ways. The human resources has to change in our offices, the privacy and security things have to change in our offices, and of course the billing. Now all of these new regulations affect us all, no matter whether it's a large office or a small office. We're going to talk about specifically how the changes affect us with our human resources, how we hire people, who we hire. And then it's also going to go into the office procedure changes, because there's all kinds of new requirements for logs. There are all kinds of training requirements now. There's also all the privacy and security changes, as well as the new requirements of HIPAA and also the new auditing. Now, these include self-audits as well. So everything changed. Back in January, I saw a press release from Secretary Sebelius. Up until then, I really hadn't realized how much change was going into place. And she commented that this was the biggest change that had gone into healthcare since HIPAA was first introduced in 2000. So with these changes, I started doing some research, and the more I dug into it, the more I realized that we have to develop new policies and procedures to make sure that we're compliant. This includes numerous things with our records and record retentions, new procedures and with how we hire people, and then how we train them. Right now, there's so much going on with Obamacare and with the new changes with regulations like that. They've done the most recoupment that they've ever done. It was like $10 billion last year in recoupment, and they're actually, using this then to help pay for Obamacare. So they're going to recoup everything they can. Now, they promised us that if we're if we're trying to be compliant, that they will be as lenient as possible with the fines. Now, they're still going to recoup every dime they can get, but at least they'll be easier on us for the fines if you're doing your due diligence. And this means all sizes of offices, even micro-size offices like mine. I just have a couple staff and my associate doctor working in my practice. Well, we've got to comply with all these same regulations that the larger practices, the hospitals do, things like that. So there's many aspects that we've never really had to worry about in the past because we were so small. But now with the new regulations, There's extremely high fines. They've changed a lot of them from 25,000 all the way up to 150,000 per incident, and they've been nice to us. They capped them at $1.5 million each. So these new penalties are for anything from purposeful ignorance, like we saw in that brochure or that slide that the OIG put out with some of their training. So, myself, I couldn't survive a $150,000 fine, much less a $1.5 million fine. Where did this all start? Back in 2000, CMS put out a comment period on things to improve the compliance and improve how healthcare professionals operated. Now, when they put out their recommendations, these were all voluntary. They put them out, and then they got feedback from the providers. And then in 2005, they revised the guidelines based on the feedback that they had gotten from the providers and from the hospitals and things like that. So the new ones were put out in 2005. Hospitals, the large clinics, the big practice management groups, they began then training their staff and putting these practices into place, knowing that eventually they would become mandatory. Well, then when ObamaCare was being put together, they stuck in one of the clauses in ObamaCare that as of January 1, these compliance guidelines were now mandatory as they work to improve quality of health care in the U.S. If you're working with Medicare or Medicaid, these guidelines have now become mandatory. So even if you only have one employee or one patient, you must follow the new regulations. Third-party payers. Boy, this has really been coming down the pike too. I know I got my first reminder from Blue Cross Blue Shield in January. They were talking about their Medicare Advantage providers having to be in compliance. They sent out 2 more since then. Each one is getting a little bit more emphasis on the requirements and having everything in place by the September 23rd, which is the main guideline for the deadlines for the new guidelines. And from what I'm hearing in the field, I'm pretty sure we're going to eventually have to attest to each of our providers that we are in compliance, because they have to turn around and do the same thing to CMS to show that they're in compliance. So watch for these notices from the insurance carriers. They're going to be requiring us to sign off that we are in compliance.
Don, I need to break in for a second, and I'd like to. The questions that we're getting from you guys are really good. At the end, I'm going to try to interject some of the questions, and we're going to have a Q&A section. So if you can have any questions along the way, please write them down, and we will get to them. One point that I'd like to ask right now, just to get an idea of where people are in terms of their practice, because from currently the way the world currently is, we all should have a HIPAA manual. We've learned about that a couple of years ago. We should also have an OSHA and a safety manual. Theoretically, many people don't. We should also have a human resources manual and a staff manual, as well as a procedure manual of how we do things in our office. If you could click how you're doing in your practice, which of these manuals do you have? We'll share this with you guys in just a second, because from the work that I've done with consulting with different practices and different people, I found that the more organized a practice is, the more they have everything documented, and the more effective the business is running. This is one of the, I think, silver linings for what these changes are. By forcing us to comply, taking advantage of that to become more organized can end up actually helping the bottom line. So I'm going to close this in 5 seconds. If you would like to vote, vote now. 4, last chance to vote 3, last chance 2, last chance 1, and closing. And I'm going to share these results. And when you look at it, looks like 2/3 of us have policy and procedure manuals going on. Less than half have OSHA have OSHA manuals. Maybe 2/3 have HIPAA, and only half of those track when there's a HIPAA violation, which, as I understand it, is one of the big things for the coming changes. So that basically, now that we know where we are now, Dr. Cross, I'll let you continue.
Thank you very much. And that fits with what a lot I hear from talking with doctors in the field, from my colleagues, my friends. That fits pretty well. You know, but now with how things have gotten, with the, especially with the stuff in the compliance program in Obamacare, you know, they want us to really step up our game. We need to have written policies that are in the formal format that covers our operations and procedures. So that's going to, you know, be incorporating into our compliance manuals, the human resources. We have to have specific policies now on the training and also on disciplinary. They actually want us to have a written disciplinary process. So the safety manual is, well, you know, they're working together. So if you have one problem and they get one audit started, you know, you may have to end up getting audited by OSHA and everybody else under the sun. So we need to have all these regulations and all these manuals in place from right now. And then, of course, the HIPAA manual, which we have to rewrite for this year's changes. So these are the things that we really have to focus on. The security, and that's going to talk about everything under the sun, then staff training, the documentation, the disciplinary, and now also something that's new for us is the self-audits and having these written corrective action plans. On the security, some of the things they talk about is we have to have written policies that grant the access to our staff, who gets access to what. We have to have more secure passwords. Now they're suggesting that we use a 22-digit word, or 22-digit password to access our databases with our patient information. If you're going to be doing just your screensaver, an 8-digit password will work for that. But to get into your main database, they suggest or request the increased security to a 22-digit password. And of course, if there's any violations, they've now increased the fines. With our written protocols for these breaches, we have to have a written procedure on how we would investigate it. Who determines if there was a breach, and who is actually responsible for grading or saying what type of a level of breach this was. And then, of course, you've got your mandatory notifications of your patients if you have a breach, and there's procedures for that, everything from written notices to ads in the newspaper, posting on your website. You know, all these different things now are mandatory, and they go into effect at different levels of breach. So you have to have then a written corrective action plan if you know, you have a breach, that you've got to take and document everything you do to make sure you're meeting all of these different points. So more so than ever, there's so much documentation that is now required. We're also required to have a code of conduct. They want us to stress to our staff how important it is to operate in a fraud and anti-abuse environment. They don't want us to do anything improper. They want us to train and be proactive in how we train our staff to have a better understanding of the different procedures. Now, of course, everybody knows about all the whistleblower things going on with the different things going on with NSA and stuff like that. Well, they want to incorporate that into our systems as well. We have to have a clear line of communication established in writing, so if one of our staff suspects something is going on, that they know immediately who they have to contact to report it. And we have to make sure that in our policies we have that there will be no retaliation against them for bringing up that there is a problem here. So that all has to be written into our procedures. The billing procedures, they want us to have guidelines for each payer type. You know, all of this is designed to decrease the errors in the billing. And obviously, anytime you're dealing with the government, you're going to have more documentation. Complete patient records. You know, here this came up just again in April. They did another cert review of chiropractic records that were being submitted, and again, 75% of our records did not pass that inspection. They were still coming up short. It might be just as simple as not putting the level that was adjusted into your notes. You know, you can't say adjusted T or adjusted L. You've got to say adjusted T6 or you've adjusted T1. They want the actual segment. If that is not in your notes, then it automatically does not meet the minimum requirements. So this is, something they really know that we're really poor on, and they're really going to emphasize and go after our problems like that. And then making sure that our billing matches our treatment documentation. So if we're saying we're treating 3 areas, the documentation has to be there to support all of that. There's also a change in the patient access. Now there has to be a proper procedure written in writing for how the patient can request a change made to their records.
So, give me some, Dr. Cross. I've got a little bit of background in that area. When you say patient access, how detailed do you have to be? What's the process for giving patient access to the records?
You have to have a form that they can fill out that notifies you that they think there is an error in your records. Then you have to have a procedure in place to take that form with what they think the correction should be and review your records to see if it's correct or not. And then to see whether it's something that came from our records or whether it's coming from medical records from another office. And then you have to document whether you were able to make the change or the change was not necessary because it was not part of our records that it was created from. Oh, paper trails, yes. We've got so many paper trails we have to require. With any type of government program, you can expect that. But now you've got to make sure that you're going through all of the anytime you send out patient information, whether it's faxed or emailed, you have to keep a record of that. Then you've also got to show, if anytime you make a referral to another provider, you've got to keep a record of that. And then you have to have this mandatory training for your staff, and they have to sign off attesting that they've had the training. So if there is a problem, if there is a breach, they come in and do an audit, you can show that you actually had trained your staff how to do that. The disciplinary guidelines, a lot of us never really wrote those down. Well, now we have to have them in writing so that we can show that we have a non-retaliation policy for any type of whistleblower situations. So all of this, you just have to, as with any type of government program, you've got to document to prove your innocence. But look at it. Being more organized is a good thing. The self-audits. There are 5 specific different types of self-audits that are now required. And, some of these are very easy and very simple when let's say you're reviewing your billing process. Who checks and verifies the insurance? Who puts that information into the computer? Who takes the EOBs and posts the payments? They want to look at your procedure to make sure everything you're doing is appropriate. And they also want to look at your documentation, so we have to do audits of our paperwork. Then we've got to do actual HIPAA compliance to make sure all of our security measures are being followed through on. Then if there's some sort of investigation from an outside agency or from a third-party biller, we've got to keep all these types of documents, and we've got to show that we have written procedures to handle each of these different types of audits. They even go to the point that they suggest how often we have to do these in a minimal manner. If it's for some of them, it's only once a year. Others, they want you to do it once a quarter. Others, they say, on an ongoing basis. So they actually define out how often in the minimum amount that they want us to do these. These compliance reviews, are basically, a self-review. They have to review our training logs to document our compliance. All of our authorizations have to be reviewed. Record retention. What was something that when I started digging into this, I didn't realize all the regulations concerning our records. There's more to what we have to hold on to than just our SOAP notes. How long do you maintain the EOBs? How long do you retain job applications for people that don't get hired? All of these have actual federal guidelines, regulations, or actually laws that cover these that in small offices we don't normally watch, but we're still covered by them. Same thing with the kickbacks and the self-referrals and inducements. I'm in a small office. I don't really have any type of thing where I can worry about kickbacks or the self-referrals. But there are things that have come up that, such as the kickbacks. When I was reviewing that, it's like the professional courtesy. I treat some of the medical doctors in our area, and typically in the past, I would either not charge them or I wouldn't charge them their copay. And but based on the kickback regulations, I can't do that. If there's somebody that can refer me a patient, I cannot give them something that we've considered a kickback, like writing off their copay. So, that was not something that I was watching, but now, it's something I know that we have to pay attention to, because these are the type of things they're looking at with some of these audits. So with all this stuff going on, you can see why, the large facilities, like a hospital or a nursing home or something, has a complete compliance department, or at least a full-time compliance officer. There's just so much to do. So all of these require a written plan, and you have to have your complete, for your corrective action plans, specific things in there according to the level of breach. And that
what are some of the levels of breach? I've heard some talk about this, and I'm really not clear what that means.
Well, there's all kinds. The very basic would be if you had a patient's file laying open on your desk and a visitor walked by and could see somebody's name on the file. That is actually considered a breach. A person's name is actually part of their protected health information. Or it could be, I like the example of, say your front desk person decides to have a Tupperware party. And so, during a slack time of the day, she goes through the database and pulls out 10 names of patients that she likes, that she thinks would come to her Tupperware party. And so she writes their names down and their phone numbers down, and then goes home that evening and takes those numbers and those names and calls them up and invites them to a Tupperware party for Friday night. Well, because that is from the patient database, that is protected health information, and if she was to call those people, every person that she calls violates and breaches your security. So if one of the people that she invited, let's say was an attorney, was not happy that she got this phone call for this Tupperware party, and she files a complaint. Well, when they come in and they find out that your staff person, took out 10 names and that she used this in a manner in which profit was gained, then you're probably going to have a fine for $150,000 for each one of those.
So would that fine be different if you had told her not to do that and documented that you told her?
Exactly. That's where a lot of the documentation is our best defense. If we can show that our training went over this type of things with our staff and that the staff person had signed off on it, then that's going to help mitigate or decrease the amount of fines. If you have no policy in place and if you have not done any training, they have said they're going to, go after you. They are taking these things very, very seriously. So, even something as simple as a Tupperware party could put you out of business. We don't have to worry about the big breaches, just the little breaches can cause so many problems. So all of these changes have to be in place for the security by the September 23rd deadline. That includes, changing our HIPAA manuals, changing our forms, changing our privacy policies, changing the form that we have our patients sign that we usually just basically call our HIPAA form. That's actually the Notice of Privacy Practices form. That has to be changed. There's been some changes on that. The changes to the business associate agreements. Those are some very significant changes too. Now those are good for us because it passes on a lot of the responsibility as well as the fines to our business associates if there's a problem, where in the past we were held responsible a lot more for what they did. Now they have their own responsibilities and their own fines. And all of these have to be in place by the 23rd of this month, so the timeline is really getting close. One of the things that I've been teaching for many years was how to do an employee handbook manual for our offices. And they were basically used to give our employees the general idea of what our policies are, how we like things to be done, and we use those to train our employees. They were an employee handbook type. Well, now with these new mandates, they want us to use very formal. One of the articles I read that they put out was talking about, it has to be stated that the employee will do something, not may, but will do something or must do something. We must put these formal policies in place so that there is no gray area. They either do it or they don't, and they want these in place. So that requires written formal policies and procedures. The human resources changes, also affects us with our who we hire and how we train them. Everybody should be checking the exclusions list on the CMS website to make sure that you're not hiring somebody that has had problems in the past with the Medicare or Medicaid fraud. You've got to do that. You've got to check that. You've got to make sure that you document that. And then you've got to document all this other training as well, and showing that, proving basically that you've done this by having these logs created to show that the documentation was there. Don't worry, be happy. It could be worse. It could be your job to do all of the compliance things for a hospital. I can imagine the headaches that they're going through right now trying to get all this stuff in place by the 23rd. So it could be worse. You could be in a hospital for it. So a quick summary. Specific elements of the compliance program have been coming out for a long, long time. I was surprised with how much training material is out there for us. OIG has released form after form, has released training documents, slide presentations, all kinds of things. Same thing with CMS and even Medicare. There's a lot of things that have already been out there. That's what I used putting together this manual that I'm using. Is I took that information and put this in because this is supposed to be a living document. It's going to be changed as it comes about. One of the things I did with my manual, and I know a lot of guys did, we took our HIPAA manual, pulled out the forms we had to sign, signed it, stuck it back in the manual, and put it on the shelf. That's what we always did with our old HIPAA manuals. We can't do that now. There's just too much going on with what we have to do and how we operate. The standards of conduct have to be written, and this is more than just our mission statements or our vision statement. This is they want this to talk about the honesty and the accuracy of our records and how we do things. So we have to have procedures written. We have to comply, have a compliance officer appointed, and they have to have written duties. Then we have to review all of our compliance policies on an annual basis. That'll be the main responsibility of the compliance officer. And then you're going to have to establish a whole series of logs, including a log of inquiries, which means this is where you'll log all of the inquiries from insurance companies or from federal agencies, from the CMS, things like that. And all of this must be ready to go on the 23rd.
So Don, Dr. Cross, in terms of clarifying, one thing that I found interesting was if someone wanted to do this themselves, they could, because this information is all on the web, and I believe some of the state associations have given the doctors some of the basic forms that the examples of them are on the web. But what's not together is how to put it all together. Is that correct?
Right. I wrote this and put this all of my programming together, the OCCM manual, based on this information that I would need in running an operating procedure manual for myself. It has all the different training things that are required, as well as all the documentation. Next. We have job descriptions written that gives out the a line of communications, a chain of command, basically, the self-audits, all the record retention regulations, all these things are built in there so that, you can operate within the guidelines and be compliant. And you must have these written procedures on when and how to notify the Human Health, HHS, excuse me.
Human Health Services.
Yeah, thank you. Next. document, document, document. I worked for the state of Florida for about 10 years, and one of my main responsibilities was to go into a facility and audit them to see how their operation stayed within the guidelines of their policies and their procedures, because each facility had to be compliant by the American Correctional Association's standards. So I had to learn how to write policies and procedures that would stand up in court. And so I was trained by a team of attorneys on how to do this. And document, document, document. One of the main things that they pound through their classes is you've got to document this appropriately, and that means maintaining these logs that to show that you've done this. So you write your policies and procedures. They have to be written in a specific type of manner that will basically stand up in court. And then you've got to document and log all of these different things that you're doing, so that if you do get into into an audit or have a huge fine, your logs will be your best defense in case of a breach. So what do you do to start? Well, first you got to figure out where you're at. Are you using a employee handbook type manual? Or do you already have a good policy and procedure manual that you can just edit and add to? So whichever place you're at, you've got to know where you're starting. Once you've determined that, you need to appoint a compliance officer. Now, compliance officer should not, in my opinion, and what I've read from CMS and all, it should not be the doctor. Your compliance manager is probably going to be your office manager or your business manager, somebody like that. It should not really be the doctor. And you need to then produce your code of conduct, for your practice that's individually set up for you. And then, of course, put together all your manuals with your new procedures, including your written disciplinary procedures. Now, it has to be a tiered system, so, you've got to put that in correctly. Then train your staff on the new procedures. Of course, log it. And then, remember, you can introduce these new procedures gradually. You don't have to, like I said, you don't have to shut down the practice one day, put all this into place, and then start up the next day. It's not meant to be that way. It's meant to put these procedures in place, and you gradually will bring your program into complete compliance. And then once you get things up and running, then you start your self-audits. And, of course, whenever you do a self-audit, there's a problem, you correct it, and you document it. Depending on the seriousness, it may be nothing more than just doing a simple note in a log. Don't take things for granted. I know in my office, we never worried about a lot of these different regulations in the past, but the whole atmosphere has changed in Washington. Now the different agencies have been mandated by President Obama to cooperate and to work together. Like the FBI, their budget this year had $130 million in their budget was to go out and look for healthcare fraud and abuse. So they've all been working together so much better. We just heard in the last few days that 7 doctors had gotten the OIG letter, which is really bad. Medicare is bad enough, but if you get an OIG audit, it's really bad. So it's going on now, and what I'm hearing from Washington is that every chiropractic office in the country can expect to be audited. That there's only 30 to 40,000 of us, so there's not a lot compared to 500,000 medical offices. So they already have plans to hit every chiropractic office in the country. Now, I've already been hit once. I've already had my first audit this year, and I expect 2 or 3 more over the next 2 or 3 years. One, because I'm teaching this stuff, so I'm a target. But every office should expect to be audited 2 or 3 times in the next 2 or 3 years as all these new procedures drop into place. So, in summary, the new changes are here. Everybody's going to have to comply with them. It's so hard to operate and see patients without being under these restrictions. They've written them very, very tightly, so it's hard to be able to get exempt from them. They're going to be mandated for us all from now on. So, it doesn't matter whether you have more than 15 employees or less than 15 employees. You're going to be covered by these regulations. So, plan on it and just stay tuned, because I'm sure there's going to be more changes coming down the road.
Dr. Cross, it's intimidating, and we've gone through this a couple of times, you and I, and each time I'm seeing new facets to it from a practice point of view. And I'm going to hit a couple of questions that people have asked, and we're going to go over some words about the manual system that you put together. But to put together a couple of questions, these do I correctly understand that all these regulations apply even to chiropractors? Does this still apply to small offices with, say, with 5 staff members? And is the deadline specific to contracted providers, or does it include out-of-network providers? So how do
Yes,
you
yes,
answer
yes.
that question?
The way they set it up, if you basically have one employee, a whole set of regulations cover you having just one employee. And then there's other set of regulations that apply if you have one patient. Then there's some things that you have to be billing Medicare or Medicaid for to be under, but they've been very, very good at making sure it's very difficult not to be covered by these. And they've already said that if somebody says that they're exempt or that somebody says that they don't apply, that they will look at that person because they think that's going to be purposeful non-compliance. And they've said if they find anybody that's practicing purposeful non-compliance, they're going to throw the book at them. They assume that because of the way that the regulations are written, almost every doctor practicing in the country is going to be covered by this. So if you think you're not covered and do not follow the procedures, they're going to look at you very, very closely.
Well, I'd like to talk a bit more about your solution for this, the ObamaCare Compliance Manual, and the thing that I think is cool about it is that it's broken down into 4 pieces, and it's very systematized, which is the way that we always ran practices. The introduction tells you what you have to do. The launch document is the beginning of it. The forms and logs tell you what you need to do, and the manual is what you use to answer questions, to create an individualized manual, as well as the tools for audit. Can you talk about this at all, Doc?
Sure. Back when I first realized what I was going to have to do in my own office was to change my operating procedure manual and create one that was actually a formal one like I used to work with back when I worked for the state of Florida. So I knew I was going to have to rewrite the whole manual and put everything in it. So I looked and scrounged through all the different regulations that I could find and put together a manual for myself. Well, this was to cover everything from OSHA to EEOC to ADA, all the acronyms. And I put this in my manual, and I showed it to a couple of my friends, and they immediately wanted a copy for themselves. Well, so I decided to go ahead and rewrite it in a manner that would be usable for other people. And so that was my whole basis of starting this up, was to write this first to cover my own assets, and second, to make it usable by my friends. And I've got one really good friend that hates paperwork. I mean, he hates paperwork. So I wrote the manual and put this program together with him in mind. I wanted something so simple that it had every step laid out for them to do. And that's one of the things I found when I was looking around, that the other programs I was seeing wasn't really being that detailed, or wasn't providing for all the different things that we needed. There wasn't a complete program out there that I could buy for myself or recommend to somebody else. So that's why I put this all together, and the whole thing is not just the manual, but it has the manual too, but it has all the new forms, because some of our forms have to change, such as the authorization for release of information, or the authorization to transfer records. These forms now have to be changed because there's new wording in there because of the HIPAA regulations. So I redid every form in my office, and there's over 80 forms that I've redone and made them modern and up to date with all the different regulations. So with the program, when you generate your manual, you also generate all of your forms. The forms come out with your information on them already. Then it also has the complete training operation, including staff meeting agendas. They're already written out for you. All you have to do is copy them. Then there's a preparation sheet for each of the agendas for the staff meetings, so your compliance officer or the doctor can both read them and be prepared to give the staff meeting training. There's then the log forms for all of these different logs that we have to do. And then at the end, I put together all of the audit tools and the self-assessments that we need to do to make sure that we're compliant and that we're following through with all the regulations. And like I said, the whole thing was designed for my friend who doesn't like paperwork, that this steps you through step by step by step. You have all the procedures then that you need. This is a complete program for an office under 15 employees. Now, why I say 15 is because many of the employment laws change at 15 or at 50, but a lot of them change at 15. So this was written, even when I had 2 offices, I still didn't have 15 employees. So this should be applicable to almost all the chiropractic offices out there.
The way that you've systematized this begins with the launch document, and it's very sequential. It's very A, B, C, D. The way you start, you click on the launch document, you put in your password, you fill out the fields, and you hit print, and you read it, and then you use it to file in the appropriate place. And the documentation within that launch folder includes an overview of how the whole compliance program works, an overview of how the launch works, setting up the manuals from taking the covers to putting them into a binder that you can buy at Office Depot, to the staff meeting agendas, which I'd like to mention that because one of the things that is important is having an ongoing process. Creating staff meeting agendas to begin the process of doing quarterly compliance meeting, I think is a brilliant way to systematize what's going to become how we need to do business, which is tracking compliance and beginning the whole process with the forms to appoint a clinic privacy officer and have that person be the one that is creating the manuals and going through the questionnaire to answer for that practice and generate the manual and putting it together into binders of the master copy as well as the training copies of all the different sub-manuals, the compliance manual, the office safety manual, the operations manual, and the HR manual, and putting this into an organized fashion is something that really does make it where a lot of complicated things are being organized well. From the manuals as well as the different logs for the compliance officer, the front desk, and the things like X-ray and other miscellaneous logs. So
remember now, this was a chiropractor writing this for a chiropractic office. It's not like, there's some things out there you'll find that were written by an attorney or that was written by a trainer. But this was me writing this for my buddy. Okay, so it's written in knowing how the office actually operates, what happens on a day-to-day basis within an office. And then when you customize it, you put your own information in, and so when the manual comes out, it has your vacation policy. It has your bonus policy if you have one. It customize it to how you run your office, and then you can add in other procedures to do other things in your office, but the things that are required by law are all there written for you, and they're written in the nice formal legal manner that they're required for. And the whole process, like I said, is set up for a chiropractor to do it, and actually it's set up so that the chiropractor can actually pass it on to his office manager or compliance manager to take care of. I know that the doctor in the office doesn't have the time or doesn't want to deal with all of the little details that the compliance managers are going to have to do, so it's written so that they do it and not the doctor.
Well, in terms of the two pieces of it, the compliance audit set is something that people can get by itself, and that is 129, and that's basically checking to see how you're doing, so that someone that has all the policy, procedure, OSHA, and current HIPAA manuals, that's all they need to be able to track how they're doing. But the full package that you put together is regularly $4.99. Also includes a free subscription to the quarterly newsletter that you'll be doing that includes a new agenda for the staff meeting for that quarter, which will include updates and other changes that happen with compliance.
Right. I set this up so I'm not going to just give it to you and forget you. The newsletter will help keep you up with what changes are coming out of Washington. Will help you use that in your practice and then train your staff on it, so that this will be something that will be an ongoing process, and I'll make sure I keep aware of what all the changes are, so you don't have to worry about it. That's what I do.
Okay, Dr. Cross, we said we're going to do some Q&A, and you've got a whole bunch of questions over here. Can documents be kept electronically?
Yes, yes.
Okay, and these documents are electronic PDFs, so they would work with an electronic system, but you need a way to be able to time date it so that they know that you didn't do it the night before, which is why for most small offices, my personal leaning is, even though I'm a computer guy, doing it on paper is probably easier and safer to do it systematically. If you invite a patient to a gathering, like a garage sale, is that a breach?
For a garage sale, if you're inviting them in your office, yes. Now you can actually include statements in your records that you've asked the patient if it's okay for you to advertise or talk with them about things like that, and that gives you permission to do it. But by just taking their name off of your database and emailing them or calling them to invite them to a garage sale, no, you cannot do that.
Okay. If your chiropractic patients are on an email list and you're informing them about a class that you're sponsoring with a cost, is that okay, or is that an issue, or can it be contained?
It can be done, and so long as you're talking about something related to healthcare in that class, you're okay. But if you're talking about painting or ballet, no. But if you're talking about a healthcare issue or healthcare guidance, then that's okay.
Uh, do if somebody sends a birthday card list, if someone sends a birthday card to a patient with a thing on it that says it's a free adjustment within 2 weeks of their birthday, does that work?
I wished it did. I've been doing that for 20 years, but now when I've really started researching into this, Medicare considers an inducement if you send a Medicare person something of greater than $50. So if you're in my office, my regular adjustment is $65. So if I send somebody that's 65 years old a coupon or a birthday card that says they get a free adjustment, I've just violated that Medicare rule. So for people under 65 or that do not have Medicare, you can do that. But for anybody that's a Medicare patient, you cannot send them something of value over $50.
So, in other words, the federal government is telling me that my Medicare patients are stopping having birthdays. I'm looking forward to that.
Right. It doesn't make sense. The people that need the most help, we can't help as much as we could.
Question: if someone gets the downloadable version now, are they compliant? Are they considered to be incompliant on September 23rd? How does that work?
Well, one of the things that you have to do is you have to adopt the manual and the procedures. And there's a form in there. It's like one of the first forms that you print out. You sign that and date that. And then as of then, you are now in the process of becoming compliant.
There's going to be a bunch more of these things of these Q&As on ObamaCareComplianceManual.com. Question: testimonials. Is there a problem with patient testimonials?
Not if they gave you written permission to use it.
Is postcards a HIPAA violation? For example, like you missed your last appointment.
I've heard yes and no. My gut reaction is that it's not a serious breach, but the new guidelines allows a patient to specifically state that they want their information only sent to one address, or they want their phone calls for reminders only to go to one phone number, or that they don't want any of that. So it's a gray area. I would suggest talk to your own attorney about what they think of it, whether it's a violation or not, because the postal person is going to see that. Is that going to affect your health or your healthcare information? No. But I've not seen anything out of CMS or OIG about those type of cards.
Well, when you do, I look forward to seeing it in the quarterly newsletter. How about sending out birthday cards without a free adjustment? Just happy birthday.
Well, that's fine.
Okay, Dr. There's a bunch more questions that are here. Oh, is emailing records to patients okay?
Well, they have the option of having them sent to them by email. That's one of the things the government says they have the option to do. But when you do that, you have to encrypt it. And that's really simple to do, and there's free programs out there for encrypting, but you should never send out any type of email with patient information on it unless it's encrypted.
Okay, there's a bunch of other questions that we're not going to get to. Again, there'll be more Q&As on the website. Right now there's some. There's going to be more over the next couple of weeks. This is not something that people are going to be compliant on the 23rd, and the HIPAA police are not going to be knocking on the 24th. But down the road and over time, the beginning that you should have started doing this is the 23rd. And Dr. Cross, we really appreciate your efforts in getting us to where we can be a part of 21st century healthcare and doing it in a way that stays compliant. Is there anything else that you'd like to say?
Just remember, it's an ongoing process. And the way I've put this procedure and this manual together is for that to be an ongoing process. And so it's not just a one-shot deal. You have to, adopt the manual, start putting the things into place, and, just gradually adopt all the new procedures or the changes. But a lot of these procedures are going to be exactly like you've been doing things in the past, except now they're actually written into a formal policy and procedure. So remember, I was writing this as a chiropractor for a chiropractic office.
Well, and again, getting more organized, getting more systematized, something that I've always promoted in offices that we've worked with, and having a tight organization begins with having it documented of this is how we do things. Check out ObamaCareComplianceManual.com for more information both on the HIPAA requirements as well as the manual. More of these questions will be answered going forward, and more information will be available in the resources that Dr. Cross answers these. One question that came up, does the OCCF also include the office procedures and HR, Dr. Cross?
Right. This is written out to be, it was written by me, a chiropractor, for chiropractors. So it was all written with procedures in there for all your HR situations, whether it's how you give keys out, the things like that are all in there in nice formal procedures for you, including all your HR stuff. In the HR, there's also suggested interview questions that are, shall we say, clean, that don't get you in trouble with the ADA or doesn't get you into trouble with the EEOC. Those are written out. There's actually a method and a form to use to grade your applicants so that you have a written document to show that the reason you hire this person over that person, which if you ever do get sued for something like that, now you've got it in writing. It's very easy for your attorney to defend you. All that kind of HR stuff is put in there.
Okay, we have a bunch of questions that I'm not answering, a bunch of hands that are raised, and we had hoped to be able to have more interactive time, but right now we've already gone close to 10 minutes over. One question that I think is a really good question: do people have to log when you mail out things like birthday cards and recall cards?
If it goes by mail, no.
Oh, so it's all electronic. That makes sense. Got it. Dr. Cross, is there anything else that you'd like to share before we knock off? Because I'd like to keep us within 10 minutes of being over.
Okay. This whole thing that I put together basically was to protect myself, protect my assets, and then after some of my friends were talking to me about doing it, they wanted it for them. So basically, this was written to protect myself and my friends. And I went through every regulation, every law that I could think of, trying to see, what would be necessary to have in those written procedures for that size of an office. And so, this is not that's something that a trainer has put together. This is not something that an attorney has put together. Of course, our attorney has looked at it and reviewed it and gave it the stamp of approval, but this was written by a chiropractor for a chiropractor.
Dr. Cross, I'm proud to count myself among your friends, and thank you for putting this together for all of us and for my friends that are here. From a practice point of view, I don't like this. This is an absolute pain. However, it does force me to become more organized, which is a good thing. And especially in the world that we're going into, we must be complying with things, and building the systems now and sooner makes sense rather than waiting till later. Dr. Cross, thanks for joining us. Again, this is Dr. Steven Weiniger. Thank you for coming. Have a great afternoon.